There's one in particular that came back to see me 2 or 3 times for asthma, and nobody has asked the child if he smokes.
Yeah.
And apparently he smokes cannabis like every day. Like, how many visits have we had to finally get to this?
Yeah.
Like, nobody ever asked this kid. That was the point where I was like, this is a problem. Like, we aren't asking these kids anything. We don't know how to ask them. We don't know what to do when we ask them. We don't know what to do.
Substance use disorder touches all our lives, and often we feel hopeless or frustrated in our pursuit to understand how and why it happens.
Welcome to APC Recovery Cafe, where we discuss the topics and trends around substance use, provide education and resources, offer recovery support, and also discuss prevention tactics, all through the stories of the people who have been there.
We invite you to grab your favorite coffee or tea and join us for a variety of guests that will bring understanding, information, connection, and hope.
Together, we can break the stigma and pave a brighter future for each other.
All right, welcome everybody to this edition of the APC Recovery Cafe. I'm your host, Edward Taylor, Director of Prevention Initiatives at the Addiction Prevention Coalition. I wanted to introduce our guest today, Dr. Rebekah Savage, our favorite. So Dr. Savage is a pediatrician specializing in treatment of substance use disorder in adolescents at Children's Hospital. She's also our primary referral source for peer work in adolescents, and those come to me. So how you doing today, Dr. Savage?
I'm great.
Good.
Thank you.
So
happy to be here.
Yeah. So as we always do on the Recovery Cafe, this is a cafe theme, and so we like to bring our guests a beverage of their choice. Dr. Savage's was the most difficult to find. And in fact, I couldn't even find her first choice, but I found something suitable as the second
it's fine.
choice.
I like it. Yeah.
So what are we working with here?
So I have a Milo's Splenda tea, because you gotta cut down on the sweet some.
Yep.
You gotta try. So Edward was so nice to grab me a Milo's Splenda Sweet, 0 calorie. My actual favorite, which I challenged you with. I knew it was a challenge when I sent it, because it's hard to find. Like, I had to fight a lady at the grocery store once to get a 12-pack.
I was about ready to fight somebody for it. My God.
I've never found it in any gas station.
Yeah.
So I don't know where
It's
Canada Dry Diet Ginger Ale, and it's my afternoon drink of choice. My morning always coffee.
Yeah.
Afternoon diet ginger ale.
Yeah.
Anyway, I like Splenda tea too.
Yeah, because your second choice you said was
half and half tea.
Yeah. And I treated myself today. I normally have seeds. I got myself a nice sparkling water there. So there's a lot of stuff that we'll get into, but I think why don't we start with telling us about the journey that you had to becoming a pediatrician that specializes in SUD treatment.
Yeah.
Kind of the backstory of that.
Yeah. Okay, so I'm going to go way back, I guess, too.
Yeah.
Yes, we like way back. Yeah. When I was in school, like even before college, I always thought I wanted to go to medical school and be a doctor and everything. And ended up sort of on that path, like when I went to college and everything, did that. But I grew up in a family where there was a lot of mental health problems going on, especially on my dad's side, and my dad and it's funny. It's like looking back when I was at that age, when I was going like as a young person, like in school and living at home. It's like you don't really quite see it, and as you get older, you start to see it more, and you understand kind of what your own family struggles with. Like when I was an adolescent, But anyway, when I was in college, it was like the second year in college or so, I had gotten a call. I just like one of those days you like don't forget, you get the call that something's happened. It's like, and I got a call that like my dad had gotten into trouble and he'd been arrested, and there's this whole then like unfolding of history that had been going on for years that I was unaware of, and it's funny, and like me and my dad were pretty close, and we're very similar personalities in a lot of ways. And so I feel like that was one well, he had been arrested for drug possession, and like he was. My dad's also a high school principal, which made it quite interesting. Yeah. So he was my high school principal, and then he became principals at other places. But he had struggled with depression, anxiety, and lots of mental health stuff. Again, runs on his side of the family, and never quite took care of it, which speaks to stigma and how we don't like to talk about these things, especially mental health. And I had just started, like many of us, like coping with drugs, and it had just escalated, and again, unbeknownst to anybody in the family. So all of it just kind of came to a head, and everything kind of fell apart in terms of the family and him and his career and everything. He sort of was in the middle of pretty terrible addiction for about 10 years, and got clean after 10 years, and now he is in recovery, and he is active in recovery, but he does still struggle with mental illness, and just, so that's kind of fast forward into how he's doing. But I think that played a role, even though I didn't, I was in college, and I hadn't even started med school yet. I hadn't really decided, okay, I'm going to do substance use work. Yeah. But it now, looking now as I've gone through this course, which I can go through more, I think that's played such a huge part in like why I do what I do. And because again, me and my dad were close. There were a lot of that time that he was using that, again, I just, as the family member, have, you've been through those times where, like, you get told things that aren't the truth, and you get, there's a lot of deceit there, and a lot of difficulties with trust, and like things that happen that, just were hard to deal with, especially as like a 19-year-old, you know, and this is your dad, So anyhow, so then after college, I went to med school, which was sort of always my goal. And I've always loved kids, and I really loved teenagers. I don't know. Even I remember writing the little essays you have to write to like get into med school or residency or whatever. They're always about like, I would do like little mentoring programs with younger kids. I was always into teens. And I realized when I was in training, I love spending my time with teenagers, like one-on-one in the room, because I like to chat with them. Yeah. And so I did pediatrics I did medical school, and I did pediatrics as my specialty. But within pediatrics, I just loved that age. Yeah. So another part of it is my background with my family. So not just on dad's side, but mom's and dad's side. They pretty much every aunt and uncle, which I have quite a few on both sides, are teachers, like teachers for high schoolers. And again, my dad was a high school principal for many years. So I've over the years, I've like realized like maybe that's a piece of me, because I like this age. I like the education of it. I like working with families. Yeah. Like the only medical person in my family is my mom, and she was a nurse, and she still is. She's about to retire, but my mom was a nurse, but like every single other person is an education and teacher person. So anyway, but I did pediatrics. I love teenagers. I decided during and again, my dad was just starting. I think his first year of recovery was when I was in residency. Oh wow. Doing this pediatrics, and realizing as I'm in this residency that there are a lot of things that are happening in our teenagers, in our patients, that like pediatricians just are not either trained or equipped or don't feel equipped to deal with. Like most pediatrics are these young kids and little babies and da-da-da. And inpatient medicine, you do a lot of sick kids who come in with different things. But adolescents kind of got like, they're like the redheaded stepchild of the world or something. Like they're just like, was that appropriate? I don't know. Sorry.
We'll say it is.
But they're just kind of, like, how do you, everybody's like, teenagers.
They're just teenagers. Yeah.
But it's kind of like that in pediatrics world, because there's not many pediatricians you'll find that just love to see those teenagers because they take so long. Yeah. Like their visits are not straightforward. Yeah. They've got all kinds of stuff. They don't necessarily tell you the truth. There's the whole, you have to talk to the parent and the patient separately a lot of times to even know what's actually going on because the patient doesn't necessarily tell you what's actually happening. So anyway, I found that out, and I was figuring out that a lot of the patients I was seeing, I started to, see more and more teenagers because that's what I like, that we're missing things. Like I remember one in particular. I told you I could talk way too much.
Go for it.
Okay.
It's my language. Go for it.
So there was one in particular that came back to see me 2 or 3 times for asthma, had been in the ER for asthma twice in like a couple months, and nobody has asked the child if he smokes. Yeah. And apparently he smokes cannabis like every day. And like how many visits have we had to finally get to this like nobody ever asked this kid. So it's just one of those things that sticks in my head is that was the point where I was like, this is a problem. Like we aren't asking these kids anything. We don't know how to ask them. We don't know what to do when we ask them. And I think that's what it comes to is we don't know what to do.
Yeah, that's what I was thinking is like surely it, that those thoughts will cross the provider's mind, but they stop themselves from doing it because they don't want to open that can of worms because they don't know what to do with that. But a couple of things I was thinking about when you were sharing all that. One was, well, first of all, something I'm really passionate about is trying to, I'm not going to say educate because I know there's education going on with this, but help doctors to understand more about addiction who might not, they might be somebody like what's an example, like a dentist or an ophthalmologist that's not part of what they do. Yeah. But there's still going to be, like the dentist especially, there will be opportunities where that might come up, especially like me, if I go to the dentist and before anything I say I'm in recovery. Yeah. I've never had any bad experiences with that at the dentist, but still, I've always wanted to help those providers understand like how to address that. Yeah. Like some knowledge they can use to make them feel more competent about it, so it's something they can comfortably talk about. And I think what you're doing is so awesome for so many reasons, but the ones that come to mind first are you have the necessary like mindset and approach and knowledge to get to kids when they're young who are using substances, because that's so frequently when addiction starts. And maybe not necessarily they're addicted then, but that's the seed that they've planted. That, like, my story is a great example of that, and so many others. So I think it's awesome, like, that you're passionate about it and you know how to actually handle it. Yeah. Because when I started using substances as a kid and I would go to the doctor, I'm sure they saw some of the drugs in like my blood test or whatever, urine sample or whatever, and like, no one ever said anything to me about it. Yeah. One of the questions I had, which you've kind of touched on, what are some of the, because I'm sure some parents might be listening that are curious, like what are some of the medical approaches to treating an adolescent that is presented to you with signs of substance use disorder?
Yeah. So let's see. When I see a patient who is coming in for whatever reason, usually it's not going to be substance use is the reason they're coming in, right? They're coming in for mood issues or anxiety or some other like ADHD, maybe behavioral issue. Sometimes they're just coming in for a checkup or for a cough. One rule of thumb is for us to be asking, like, and you're asking again from my perspective as a provider, like what would I be looking for? What's my approach? So I pretty much ask everybody I see about substance use, like even if they're there for, I don't know, just like sore throat. I don't know if I have a chance. I know this gets hard. This is why pediatricians it's tough to do it because you got to get through patients. Like you see patients in and out, you got to move through. So, but really we need to be asking any teenager or really starting at 11 or 12, about in the past year, how many times have you vaped?
Mm-hmm.
You know, and in the past year, how many times have you, and ask it that way. Like people actually study like how to ask the question in these environments. So people have studied like ask them about a time frame in the past, whatever. And then ask them how many times. Don't say, you don't ever smoke, do you? Don't say it like that. But yeah, like.
Definitely not.
Or like if you say, do you smoke? They're going to
Yeah.
say no because they didn't smoke that day.
Yeah,
You know
yeah,
what I
yeah,
mean?
yeah,
Like,
yeah.
but just how you ask and that you ask right is step one. And also given talking about confidentiality. So,
Yeah.
and the parents, this gets tricky, but like providers need to share confidentiality with these patients and parents and say that there's going to be some stuff we talk about with all teenagers that we don't necessarily share with
Yeah.
the parent, because we want to give this, we want to make an environment where they feel like they can be honest and not feel like they're always going to get in trouble every time they, you know, that they tell us something. So we try to be upfront about the confidentiality policy. It's almost like this is what we do with our teenagers across the board. But if something's happening that's harmful to that person, like gonna put them in danger, someone else is gonna be in danger, like they're gonna kill themselves or thinking about that or something like that, we have to share that with their parents. But everything else is pretty much fair game to discuss, and so that's important piece to remember. And then so much what I guess the point I'm saying is like if we ask the right way, we keep in an environment that's non-judgmental and that's open and confidential, at least at the beginning. Like sometimes I won't talk to parents about some drug use I'm really worried about yet, but I use that as like a motivator for the kid to be like, I'm not going to talk about this yet, but we need to make some goals and this is what we're going to do.
Yeah.
So I think that environment's important. And then when you hear about what they're using, or you ask them the questions, and you listen and you try to get at how, like, why, like you try to get at how are these substances helping you, or how does cannabis help you, or does it, how does it make you feel? What's the good thing about it? What's the bad thing about it? And understand how frequently they use. Try to get them to trust you over time, the kid to trust you. And then you go from there. So then you kind of have to grade the severity of what's going on as for what you do. So if a kid's using pills like opiates, certainly, or even Xanax, any kind of pills that's obtained from a friend or off the street or whatever, there's such high risk of fentanyl now.
Yeah.
That's like highest risk. Like we need to talk about Narcan. We need to talk about parents locking up all the medicine and distributing them. Well, you have to. And then if someone's taking them frequently, then we do get into medications to help keep them off of that. So that's where the buprenorphine might come in or something like that. We don't see that as much. I don't have a lot of kids on because I don't have a lot of kids using opiates yet that frequently. I say kids again. So most of the people I'm talking about are like less than 18. But every now and then we do. And we have to talk about those meds that help keep them off of, opiates. But most of my kids I'm seeing in clinic, at least, are usually cannabis is the main thing, and vaping, of course, nicotine. And then we get into, do they have a substance use disorder or not? How severe? What are the consequences? And like, do their parents know or not? Do we need to just make a goal with them and try to? We also work on like adjusting their other meds for depression, anxiety. Like if they're using cannabis because they can't sleep because they're so anxious every night, their brain's like turning and they're like, I don't know, the only thing that helps me is cannabis, then we talk about that. Well, are you on a medicine to help with that? How can we help you with that? Do you have a therapist? A lot of times we do a ton of work just trying to connect people with therapists, and we have a psychologist in clinic some of the time that can help like diagnose, like not just substance use, but what else is going on. Cause almost 100% of the time in that age,
co-occurring
yes.
of some sort. Yeah.
And like, you have to work on the anxiety and the PTSD, that whatever it is, there's a ton of trauma. There's a ton of, stuff that happens. And it's not being addressed, and the child's using substances to help them with the negative emotions and that, anyway, I've talked a lot about it, but that's, I guess, I don't know if that answered your question, but.
No, it did. Yeah.
Yeah.
I mean, so basically what you were saying was the ways that you evaluate a patient for meeting maybe criteria for at least further discussions about what they're using. And then you mentioned some of the ways where once it's elevated to a really risky situation, then that's when the medications come in. And the psychologist comes in. And then making sure y'all manage maybe the psych meds properly as well. So a lot of what you were saying, as you know, was resonating with me and some of the referrals that you've given me as a peer, which for our audience, peer work is a peer is somebody who is in long-term recovery, and you could call it a number of different things. You could say they're a recovery coach. You could say they're an advocate. You could say they're a mentor. It's not 12-step based, though. So basically, I do almost entirely adolescent peer work. And so the referrals, like I said in the intro, come from Dr. Savage. And what I will do with the referrals is I will usually start by understanding their story and hearing it out and sharing some of mine to help them understand that I know enough and I've been through enough to relate to them on a deeper level than, no offense, but maybe Dr. Savage can, or their parents or the psychologist. And then what I do is I try to figure out what kind of problems they're coming up against and help them come up with like a game plan or goals to achieve to keep them on the right track. But so much of what you said, a lot of times those referrals, I'll ask them, why have you been using substances? I'll just ask it straight up like that because I just told them I used to shoot heroin. It's like, so let's get real, why are you using substances? And they'll usually say, I struggle really bad with anxiety. That's a common one. And it was for me at that age too. And then I'll go on to explain to them, I might use a risk reward type of explanations that speaks to some of them. But sometimes I'll just explain to them too that I've struggled with anxiety since I was 12. That's when I had my first panic attack. And that's when I started using substances. And so like I tell them, I get it. You don't want to experience that. It's unpleasant. You just want to feel better. So it's natural to want to self-medicate. Much like if you have a headache, you go and get Tylenol or whatever. But the problem is Tylenol is a great solution to a headache, but marijuana is not a great solution to anxiety or mental health concerns. And so we try to work with him to figure out what's a better, healthier way, I should say.
Yep, that's what I say too.
The trick becomes when we can convince them to do that, and then I check in with them a week later, or you see them however frequently, and we ask them, and they say their anxiety is worse. Whether they're telling the truth or not, who knows? They might be embellishing, but I feel like usually they're telling me the truth because I know. And I say to them, the bad news at this point is some of the stuff isn't going to work quite as well as marijuana does, at least instantly. It's just not going to. This is a different approach to it. Therapy and medications take time to really work, but they do work. And you don't have to worry about all the there's no consequences. At least like there is with marijuana. It is a game. A game of motivation and accountability, but it's worth it. It really is. So this question for any of the parents who are listening that are concerned about maybe their kid and for any reason, whether they are using, they suspect they are, or they're just planning because maybe addiction runs in the family. What are some suggestions you can give to those parents in any kind at all, whether their kid is using or not or anything?
There's a few. This is always, I'm just careful how I answer this question a lot because I've had it a lot, and I know that it's tough on parents because it's like I can say a lot of things, but it's like easier said than done. To be a parent of an adolescent, just be like, okay, just go do that. Every adolescent's a little different too, and like temperament and personality and how they kind of approach them. But in general, I talk about parents trying to still ask questions, be involved in their child's life, like especially social media really scares me, honestly. Like the way kids are very connected, you know, as we all know, on their phones, social media. I think parents, if they're paying for the cell phone, for example, they should be able to monitor that cell phone, and that those things should be happening. This relates to some advice I've heard Stephen Taylor give. He's a psychiatrist who does a lot of this. Yeah. He's great. And he, I remember going to a talk of his, and one of the first things he said to parents was just be suspicious. Like stay. That sounds like oh man, you're always like freaked out. Your kid's doing something awful. But I think the point was be like trust but verify.
Yeah, sure.
Yes, especially if the parent has some kind of like gut, like something's not right.
Yeah.
I always tell my parents, like, you need trust that intuition and just play it cool with the kid, and but go behind and just double check. You know, that's if there's like concerns, like the child's like doesn't want to do sports anymore, or their grades are dropping, or there's little things happening. You're like, something's not right as a parent. If a parent feels like something's not right, usually something's not right.
Yeah.
So, but you don't have to jump on the kid and be like, I can tell something's wrong, kind of get on them. Just kind of stay suspicious, kind of look around, look through, honestly look through their stuff. Like if they're worried about something's happening. But I think backing up even before that, if there can be, with your child, and again, this depends on the child, you can keep as best you can an open line of communication as a family, and like expectations and boundaries are set out from the get-go. Like for example, like, if this saying to your child before anything ever happens negatively, hopefully nothing negative will happen, but be like, listen, there are certain things I really expect you not to do, and certain things I expect you to do, so these are responsibilities and some things I want you not to do, and just laying that out there ahead of time might be helpful. Like, and that way you can go back and be like, remember we talked about there's certain boundaries. Anyway, that can happen earlier on. And then you've set up also a communication between you where the kid understands that you're giving them some freedoms, but you also expect responsibility in return. And hopefully if you can also, this is a part that's hard for me, even as a parent of like little kids, is try not to overreact at the initial, like if there's a confession or something, maybe you found something out, like try not to overreact and just like if the child tells you something and you just immediately kind of jump on them, but trying to, if you need to take a moment, calm it, and then go back and talk to them about it. We talk about these things a lot in clinic, and just depend on the patient is kind of how I try to like counsel. But again, sometimes I was just thinking about this yesterday. Sometimes I wish I had a counseling degree or something. I try to remind myself, I'm like, I'm really not a counselor, but this is what I do a lot of times. But I hear what the psychologist, I've worked with enough psychologists, I guess I try to pull some of the things they say to try to help parents. But all that, I guess those are a few things. Now you were asking like if there are warning signs or things like that. That's when like I said, stay suspicious and then pull in a helper or somebody to help you. So that's either a counselor, a pediatrician, somebody that, even if you have to go to the pediatrician on the sideline or call them ahead of the visit and be like, this is what's happening, but I need you to talk to them and give them like the scenario so they can be prepped and kind of ready to have like a conversation. But get a professional to come in and sort of be there for them as another adult who can help, because the child's usually not going to tell the parent what's going on, at least in full. So, but getting help is super important with another person. What else? I told you earlier, I see a lot of eating disorders as well. But especially in that world too, like getting school involved as well. I think the more people you have on your team who are kind of surrounding your kid, and even if it's just a little, can you check on so-and-so and just let me know kind of how he's doing at school. Have like a person at school that's kind of eyeballing, your kid and like helping give you some idea of how things are going. I think the more people, the better.
Yeah.
I guess, I don't, yeah.
Yeah, that's all awesome. Great suggestions. I think, sometimes these might be referrals from you or other, some of our other partners, but I usually will talk either just as a person in recovery or as a peer. I'm usually talking to the parents when it's too late for any prevention.
Yeah.
And so I always emphasize to them that it's really important that, like you said, you don't freak out, basically. Because that's not going to help. So don't freak out about if you find something. And there is certainly a way to have that communication with your kid to where you can let them know that it's not okay what they're doing, but you are trying to help them and you're not judging them and you want them to get better.
Yeah.
Like there is a way to do that. I'm not a parent and I haven't had that experience as a parent, so I can't sit here and act like I've been there, done that, but I've been there, done that in a lot of other personal experiences similar to that, to where I know. And even me, when I was a kid, like I was more receptive when it was just hey, what's going on? Like I know I literally, we already have established you're using drugs. Like tell me what's going on, like I'm going to be, kids are probably going to be more receptive to that than I found your pot. You're grounded for a month, no phone, no Xbox, no nothing. And that's it. That's not going to work.
Yeah.
You mentioned the counseling degree. That reminded me also of another way that the APC is intertwined with you and your work there, and that's Ashley.
Yes.
But tell me a little bit about the ways that y'all work together, you and Ashley.
Yeah. So Ashley is the director of a program that's funded by a grant that called LEAP, and so with pretty much any patient who screens positive, meaning on a written questionnaire, it's called a CRAFT screen. So it's something that's validated in teenagers that ask them about drugs and alcohol in the last year. So, so if they screen positive there, or just verbally, they tell me, that they're using drugs or alcohol, then I get Ashley involved to chat with them about how much they're using. And she's also doing electronic screener to ask them questions and other risky behaviors. So she's asked them about that. It's confidential. And they do get, which it works well in teenagers, they do get, a gift card if they'll just do the
works
survey.
Well in adults,
I know.
Works
so
well on me.
The kids want the cards, the gift cards. But and then I also just I think she enjoys this, but I don't mean to overwork her. But a lot of times I'm asking her what else did they say? Did you get an idea of why they're using or what they're saying about their use, and get any ideas or resources she has. So and she's done awesome because she works with you guys and is very involved. She knows about the Psychiatric Intake Response Center. I think she works with them a little bit. Yeah. Where she can pull up their database of counselors who can see patients based on their insurance and location. And so she's helped me with that a few times, connect people with counselors. Sometimes we'll chat about whether or not patients need higher level of care, meaning, she'll help me make goals for patients who are just coming back to see me. But also, higher level of care would mean this child needs intensive outpatient counseling or something like that, where they go to meet with a counselor group 3 times a week. Every now and then we'll talk about going to residential or a higher level. Yeah. But anyway, so she's just been a good resource to have with me, and she really the patients get to know her, because every time they come, I just pull her in, any patient who's ever used anything.
I would too.
But yeah, so it's been good.
Yeah.
I wanted to make one comment, because this came up earlier when you were discussing when you were growing up, you think the pediatrician surely would see on blood work or testing that you were using. But I just want to make a comment, because that's one thing. When I say screening, because I've said screening a couple times, I always mean questioning or a piece of paper, because I actually don't. And the AAP, the American Academy of Pediatrics, they also recommend against just urine drug screening, just as a general rule. So I don't love to do drug screens and urine drug screens just to just to get information from a patient. I'd
Yeah.
rather the patient tell me.
Yeah.
And the drug screens are like fraught with false positives
Yeah.
and negatives. You know,
Yeah.
they just don't. And again, if we had a great drug screen, that would be one thing. Or if I think the child is like, there's some behavioral issues and I'm not quite getting the right story, like parents saying that this is going on, child's denying it. When that kind of stuff's happening, sometimes I will do drug screens. Or if I know the child has been in the hospital, for example, because they overdosed on benzos or something, they come out with like a behavioral plan, and part of the plan is a random urine drug screen. So we've certainly done that. But I just want to make this statement, like, to get at what's going on. Like when a parent comes to us as a pediatric provider and they're like, I think something's going on. Can you just screen? Can you do a drug screen?
Yeah.
I don't think that's the best approach.
Yeah.
But I just want to say that.
Yeah. Well, I think too that works in the provider's favor, because they can go to the patient and say, this is the way I operate. You know, like, I'm not going to drug screen you just to pull one over on you and be like, I got you. That's not how I do things. I want to help you. Talk to me honestly.
Yeah, exactly.
You know, that you could use it that way, I'm sure.
Yeah.
So last question, arguably the most important, I think. Can you tell those who are listening or watching how they can get resources and information about substance use disorder treatment for adolescents and ways they could benefit from your services?
Yeah. So resources, I think of you guys.
Okay, that's fair. That's fair. That's
APC.
fair. Yeah, that's fair.
No, there's a lot. So seriously, yeah. So I really love what y'all do. Like, I talk about you guys to parents all the time about, you know, look at their website, check out the family groups, things like that. So, so more resources for teens. Online, I'm hesitating because it's hard. It's hard to find a lot of help, honestly. Like, especially teenagers with substance use issues. For I guess a lot of the reasons we were discussing. Like, it's just we don't ask for it enough. We don't ask about it enough as a medical community. And there's a lot of stigma, and there's a lot of oh, this is just this. Part of, they're a teenager, they're going to experiment, whatever kind of mentality about it. I can't remember the name of the website, but cannabis comes to mind, because cannabis is one of the things, like I've mentioned, is becoming more and more common. I think it's only going to become more and more common as it's legalized more. So, but it's causing more and more problems in teens, as like THC is increasing, and it's causing more like GI and psychiatric long-term problems, which I could get into, but I know we don't have time. But there is some information online. I know that SAMHSA, the Substance Abuse Mental Health Services Administration.
Nailed
Did
it.
I do it?
Yeah.
Okay.
And I always call it
SAMHSA.
SAMHSA. I'm like, I know that's wrong. That's the way I say it. Yeah, SAMHSA's good though.
Yeah,
SAMHSA.
online they have a page about it. They have, you know, NIDA, which is National Institute
Here we
on,
go.
on Drug Abuse,
Got
even though we're
that
not
one
supposed
too.
to say abuse.
Yeah.
But anyway, NIDA has a NIDA for Teens website. I think it's teens.nida.gov, something like that. Anyway, NIDA for Teens is the name of the website. They have a ton of information about like how to talk to a young person about the dangers. So thinking about parents or providers, like how you can frame it where a younger person understands what you're saying. You know what I mean? Because I jumped to cannabis because there are some websites now, some groups out there that are working to help sort of train more on like how cannabis is actually detrimental, especially in the teen and young adult brain. So, and I forgot the name of the website I was trying to get at, but I know through NIDA and SAMHSA I can get some information. That's general information. APC is more local to Birmingham and Alabama, which is great. To get to me, I work at Children's of Alabama, so most of my patients are referred from someone.
Yeah.
So, pediatrician. I have parents find me, and I'm fine with. Anybody can come see me.
Yeah.
And sometimes I'll just, parents will just kind of track us down on our website and just give us a call. And then when I hear the story, I'm always happy to see anybody. But
that's, sorry, I didn't mean to interrupt. That's just the
good.
Children's of Alabama website. They will
It's
just
Children's of
get on there.
Alabama Adolescent Health Center.
Okay.
Is where I work. Adolescent Health Center at Children's of Alabama. And it's downtown, right across from the front of Children's Hospital. Yeah, so if you Google Children's of Alabama Adolescent Health or Adolescent Health Center, all the number and address and everything should be on there. I mean, I can give the phone number if y'all want it, but
Go for it. Let's hear it.
Okay, it's 205-638-9231.
Perfect.
And yeah, my coordinator specifically, her name's Lisa. Her number is, she's going to love this. It's like 205-638-2358.
Nice.
And so I'm all about, like, if a pediatrician, a parent, if anybody calls or emails me even and is like, I got an issue, I need help, I'm all about doing what we can to help. If you just want an opinion or someone to kind of help. But I'm trying to think of the PERC, like we mentioned earlier, like, PERC is that Psychiatric Intake Response Center at Children's.
PIRC.
Yes.
Not PERC.
That's right. Or
certainly
PERK. Not PERK. Well,
certainly
really
not to be confused with either of those. It's PIRC.
Yeah, so that their number is their number is 205-638-PIRC, whatever those numbers are.
Yeah.
They can connect people with counselors, resources for substance use. They should know about me and our clinic.
They better.
They do. I think they do. I think the hard part sometimes is getting through our phone tree and through the coordinator. But that's why I'm always like, just talk to Lisa, find me, but or talk to your pediatrician and they can find me. But trying to think of any other like things. I guess those are the biggest ways. Yeah,
definitely.
Yeah.
Well, that was great. Thanks for joining us.
You're welcome. Thank
you
you for having me.
Yeah,
And for everything y'all do.
So y'all got all of her contact information and ways to get in touch with their clinic. They really do incredible work. Like I mentioned, it definitely fills a need, and you can definitely trust Dr. Savage and her team. So
thank you.
Thank you all for joining us on this edition of the Recovery Cafe, and we'll see you all next time.
One of the things that APC is known for is being a connector because we're stronger together.
Not only are we there for those who are suffering through substance use disorder, but we're there for family members, and we really take our job seriously.
We all have personal reason why we're in this field. We're changing people's lives one community at a time.